Welcome back to Yas Nexa Spark channel. Good morning, nursing students. Welcome to today's sections from SNS College of Nursing, Coimbatore. I'm KJ Yarni. Today we are diving into Unit 9 of BSc Nursing Nutrition course, which is focusing on Therapeutic Diet Part 2. We will explore nutrition modification and special feeding technique, which is essential for patient care. Let's get started. Nutrition modifications, which is our therapy diet or tailored to meet the specific health needs, by which we can adjust the nutrition content. Here, the sum of type is high fiber diet, which is of rich in whole grains and spotted grains and unprocessed foods and vegetables, which promote the digestion part. Fiber is the most important thing for promotion of digestion. And high protein diet, which is of we will be using the protein deficiency used for protein deficiencies and burns and surgicals and liver diseases or hyperthyroidisms, and which is includes of meat, fish, poultry, eggs or cottage cheese, milk and soyabeans are which will be included in high protein diet. And low protein diet for the condition like nephritis with a uraemia and combining with the skin milk with the cerebrals, which so needs to limit the nitrogen retentions. For low fat and low cholesterol diet, we will be focusing on for the conditions for heart related diseases and of obesity and diabetes, and we will also for the restricting saturated fats for the disease conditions, and for we should not include the fried food items, and which when include the cholesterols in the atherosclerosis like diseases. There is they should not include cholesterols, and which the cholesterol contains, so we have to restrict the saturated fats. Sodium reduction diet, which can be mainly indicated to prevent the edema in the conditions like nephritis. Sodium is a source of salt. We have to restrict for the conditions like liver cirrhosis and hypertension. Also, we will be using this diet, which is of DASH diet. What is meant by DASH diet? Let's see in the comments who are saying about the DASH diet full form. It's limited salts in cooking. We should avoid high sodium foods like baking soda and preserved foods. They will be adding more salts, so we should avoid them. And what is a high cholesterol diet, which is of use when to increase the cholesterol intake for patients like malnutrition. They have to increase the weight, so we will be concentrating on the high cholesterol diet. And there is maybe which we should include it on regular adding like cream, butters and eggs. It is of main essential, which is of consists of high calorie diet. Low caloric diet is of which, but when the body weight is excessive of average of 10 percentage, we will be using for the obesity patients and hypertensions. They have to take off milk, they can take, and vegetables and like egg, this which consists of low caloric diet. And this therapy diet should be involved in adjusting of food preparations. Food preparations should be according to the disease condition of the patient. It should be modified, and for the based on the category of nutrition content or consistency, they have to change according to the patient. Special feeding technique. Special feeding technique, which is of cruel when oral intake is not possible at all. We can focusing on two, that is of tube feedings, and which delivers to the nasogastric or nasoduodenal nasojejunal tubes or surgicals, or versus gastrostomy or duodenostomy or jejunostomy. These are that. And total parental nutrition, which all nutrients are directly provided into the bloodstream, used when digestive systems cannot be used at all. So we will be using the total parental nutrition so that the patient can get the all the nutrition. Tube feeding is a method. Nutrition is delivered via a tube inserted to the nose or surgical into the stomach. These are the indications where we use it of when the esophageal obstruction is there, or severe dysphagia, or prolonged inability to eat. Like in that conditions, we will be inserting the tube in the nasogastric. You will be all seeing in the clinicals. And what is the main content they will be providing through the tube is full liquid diet or commercial formula, like ensure the powder will be there, which can provide 1 to 2 calories. So they will be mixing that and providing to the patients, which all are considered for the form. We should, what we have to, as a role of the nurse, what we have to see is about the monitoring aspirations risk, and the whether the tube is placed at correctly, and patients can whether tolerate and to tolerate the conditions, and we have to avoid the complications. Total parental nutrition, which is of definition itself, say, we can know that it is of direct taking of the nutrients into the bloodstream, which can deliver the all nutrients essential, typically through the central vein, like perineal veins for the intake. What are the components it have means uh, glucose and amplified fats, amino acids, and vitamins like B12, folic acids, and potassium, electrolytes, and etc. Like a trace amount of elements like zinc, copper, and etc. Then what are the caloric needs means according to the patients it varies. For the adults is of 2400 kilocalories per day. According to each category, for the children's, for the newborns, according to that it will be vary, and according to the conditions also we can get a change. For children is 120 to 125 kilocalories is for per kg. For newborn we can say that 100 to 110 kilocalories per kg per day. These are the normal values for we should know for calculating the total parental nutrition. Total parental nutrition, what we have to main the monitoring is the main important aspects, because they may arrest into many complications. So trace daily weight of the skin fold thickness, so mid-arm circumference and blood glucose, and what are the electrolytes balance, because we are providing all electrolytes to the bloodstream. So they have to monitor the creatine and hemoglobin and amino level, so that we can get a correct process, correct level of nutrition in the patients. So we have to essentially monitor with the for the patients. What are the complications? The main is of risk includes industrial atrophy or cardiac arrhythmias and air embolisms and thrombosis, sepsis, and hyperglycemia and nutritional deficiency, toxicity. The main complications are this, and we can also get off supplementary or intravenous feeding can be costly. These are the main aspects when we use this of this is very costly, because TNP all electrolytes it includes, so it may cost around more the amount. So they have to we have to see according to the patient economic status also, and they may also have provide adequate nutritions, but when you can use up to the limit. That's all for today's sections on therapy diet. Today we have seen about special feeding techniques like TPN and also tube feeding methods. And let's explore more topics on therapy diet part 3. Let's stay curious and see you soon. This is Yas Nexa Park. Let's heal, let's learn and go together.